And let's bring in now Dr. Kerrin Begg, a public health medicine specialist at the College of Medicine at UCT. Dr. Begg, thank you so much for your time. We know that we seem to be over the worst of this wave, this Omicron wave, as we're calling it, but still 119 people dying in one day. That is still a fair number of deaths, isn't it?
Yeah. So it is, but I think what's incredibly encouraging is that we are down by about 23% versus the previous wave in terms of the proportion of deaths. So that's really impressive. That essentially deaths are sitting, only at about 23% of the Delta peak. So what we saw in terms of the proportion of cases who were admitted and then cases who died, what's really encouraging with Omicron is as immunity has gone up and vaccination has gone up, is that we've seen the uncoupling of admissions and deaths. And so whilst any death is regrettable, we are seeing a monumentally smaller number of deaths than we've seen in the previous two waves.
So deaths are down, which of course overall is good news. Do we still have that data? Is it still holding true that most of the people who ultimately succumb to COVID-19 are unvaccinated?
Correct. We're seeing that very consistently still. And so one of the challenges that we see in countries that have great vaccination is that, of course, you start to see, as you get up to 90% vaccination coverage in a country, you'll then start to see higher numbers of cases who succumb will be vaccinated, but still the relative proportion between those who are vaccinated and unvaccinated is just streets apart. So we always see that in our country, where we're still sitting with approximately half of the adult population vaccinated, that we're still seeing a much larger proportion of unvaccinated, both hospitalized as well as dying. Very few ICUs and are full with have any patients who are vaccinated, and if they are vaccinated, they generally have other comorbidities.
I'm thinking that unvaccinated people, surely some of them at least have antibodies from a previous natural infection. Does that suggest that naturally acquired antibodies don't offer as much protection as a vaccination?
No, they definitely offer us reasonable protection, but certainly we know that the immunity offered from previous infection wanes quicker than the immunity offered by vaccination. And of course, the big challenge is that whilst you may well have immunity developed from your infection, you'd really rather prefer to avert any infection altogether because of the risks that you face from the COVID infection, both in the short term, in the acute phase, as well as with long COVID. So it's infinitely preferable to have immunity from a vaccination than immunity from infection alone. We are seeing some nice results showing that really boosted infection, if you have had a vaccination together with an infection, that also shows significant immunity. But I think what's really encouraging is a study that was done on seroprevalence in December. Prof. Modi and colleagues in Gauteng really showed, which may well be part of the impact that we're seeing now in Omicron, that at least 50% of children under 12 had immunity present, as well as, and up to 80% in those of over 50. So, but those who were vaccinated had a 6-fold increase versus the unvaccinated when looking at lab immunity. So remember that laboratory-based immunity is not necessarily completely immune in terms of being infected or the possibility of being infected, but it certainly gives us a really good idea that we're certainly seeing that significant immunity in the South African population now.
Schools inland are opening tomorrow, and while a lot of schools are still on the rotational system, we know that the Education Department is pretty confident that it's going to be a less disruptive year. There are protocols in place. I think up to 80% of teachers have been vaccinated. Do you think that it can be a fairly normal school year for our kids?
So I think what we need to remember is that we're still in a pandemic, but we have reached the stage probably of moving across into endemicity. So endemic, where this is part of what we need to live with now going forward. I think what we need to understand is that those measures that we have been doing over the last 2 years, we need to continue. So we need ventilation, which fortunately we're able to do in our country with the kind of weather patterns that we have. We can keep windows open, doors open, and as much ventilation as possible. We can mask up, and of course we can be vaccinated. And certainly for children, we've got double dosing is now available for all children over 12, and we really should be doing that to protect children. And with all of those measures in place, there's no reason that we can't have as much of a normal year as possible. The risks to children not having education are so much higher than keeping children away from school. So we really need to be getting children back into school, but protecting them with the measures that we know work.
UCT, which of course is where you are based, at the College of Medicine, is one of a number of universities that is going to implement a vaccine mandate on campus. My question to you is, if we are moving into an endemic phase where things seem to be waning somewhat, do we still need these vaccine mandates?
So part of the reason that we're moving, that we've seen Omicron with less severe infections, is exactly the reason that we need to proceed with high rates of vaccination. And certainly from behavioral evidence that we've seen in the past is that vaccinations through incentives and other measures, incentives really only work to improve vaccination by about 5%. What we've seen with vaccination mandates, the evidence in previous infections is that it can increase by another 18%, 18 to 20%. So we know that those who are not necessarily resistant to vaccination, but just simply haven't got around to doing it, it's just too much sleep. Those people will be motivated when there is a reason, there's a consequence for not being vaccinated. And so certainly as a public health medicine specialist, we advocate for vaccination, and preferably we'd want everybody to choose to be vaccinated and be out there as fast as possible. But certainly we know that the public good from mandating vaccination is a good one. So certainly we are in support of vaccination mandates, want people to be vaccinated as quickly as possible, and that's our way to get back to as normal as possible.
All right, thank you so much, Dr. Kerrin Begg, Public Health Medicine Specialist at the College of Medicine at the University of Cape Town.